Health officials confirm the country has detected the first case of the Lambda COVID-19 variant. The health department says the patient is a 35-year-old female. She was asymptomatic and was tagged as recovered after undergoing a 10-day isolation period. The DOH is still trying to find out if this is a local transmission or from a returning overseas Filipino. The Lambda variant was first discovered in Peru last December. It is currently classified as a variant of interest, and the World Health Organization is still studying its clinical significance. And we now talk to infectious disease expert Dr. Edsel Salvaña. Good morning, doctor. Thanks for taking our call.
Yeah, good morning. Good morning to everyone who's watching.
Now, doctor, we've heard about this Lambda variant before, and as of the latest, it is still a variant of interest. And one look at my social media feed, some people are very worried about it. Could you tell us what the characteristics of the Lambda variant are, and how is it different from Delta in terms of transmissibility and severity of symptoms?
Right. So variants of interest are basically variants of SARS-CoV-2 that have concerning mutations. And what that means is that there are mutations that can affect transmissibility and also the ability of our vaccines to neutralize the spike protein. And so because it takes a while for people to figure out whether those mutations translate into real-world problems, then the variant of interest is kind of a holding area for those viruses that have these mutations, but we haven't proven that it actually translates into real world. If it does translate, then it gets upgraded to a variant of concern, which we have 4 of, including Delta. Or if it does not fulfill that criteria, eventually it is actually removed from variants of interest. And this is what happened to Theta, or P3, which was first described in the Philippines. After a while, they saw it didn't really follow increased clinical severity or decreased vaccine neutralizing activity or increased transmissibility. So they actually removed it. So Theta is actually off the VOI. So it can go either way. The bottom line is Lambda has not yet proven to be as concerning as the VOCs, and actually I'm much more scared of Delta. And in fact, the U.S. Centers for Disease Control doesn't even consider Lambda a variant of interest.
Right. That being the case, do we know if the Lambda variant is resistant against the vaccines?
Oh, well, let's look at the data. There's one preprint, and this is not even a peer-reviewed journal, where they tested Lambda pseudoviruses against certain vaccines, and it showed that there was decreased neutralizing activity. And so we have to understand, first of all, that vaccines work to protect us in 2 ways. First is neutralizing antibody, which affects transmissibility and whether you get disease or not. And then there's what we call the cell-mediated immunity component, or our T cells, which are a lot harder to measure, but actually protect us very well from severe disease. Now, there's 2 countries where Chinese vaccines have been used a lot, Peru and Chile. And the data from those places shows that Sinovac, Sinopharm, they work very well for preventing severe disease. The Chile study in particular is very powerful because they actually enrolled 10 million people. And in that study, Coronavac decreased the risk of ending up in the ICU by 90%. So from that standpoint versus laboratory data that's not peer-reviewed, the Chile study was published in one of the most prestigious journals, New England Journal of Medicine. I think we have fairly good real-world data that our vaccines should work to prevent severe disease for Lambda.
All right, that is definitely some good news there. Now, the DOH has said that this first case of Lambda is asymptomatic. So again, do we know if that is a distinct characteristic of Lambda, that it can be more asymptomatic than symptomatic?
No, that's not something that we know for sure. I mean, SARS-CoV-2 in general, at least in our country, has shown that there's a really significant number of cases that are asymptomatic or mild. In fact, 95% of cases are mild or asymptomatic, and that is in line with what we expect from the COVID-19 virus, from SARS-CoV-2. What is concerning, really, for us right now is whether this virus has, again, the ability to avoid vaccines or increase transmissibility, because as we are seeing from Delta is really, really transmissible. It can infect up to 8 people per infection. So it's as contagious as chickenpox. So it's very, very important to be able to prepare our healthcare systems, and that's why right now NCR is under lockdown. But at the same time, we have to continue vaccinating, because we know that if we vaccinate many, many people, especially the most vulnerable, their risk of severe disease goes down by 90%. So if we look at our current study, our current situation, where we're seeing maybe 3% severe to critical out of the and 95% mild or asymptomatic, if we vaccinate as many people as possible, that proportion of 3% that is severe to critical will go down to 0.3%. And that's going to be just like the flu, in which case our healthcare system can cope with this and we can keep the economy open. So the long-term solution to this is really to vaccinate everyone so that we turn COVID from something that kills about 2% of people to something that goes down to 0.1%, which is like the flu.
Now, Doc, you mentioned the lockdown. The 2-week ECQ in the NCR is supposed to end on Friday, August 20th. In your professional opinion, should it be extended?
Well, we'll see. We have to take a look at all our indicators. I mean, people just keep looking at the cases, and they're not looking at how well the hospitals are coping. It's very important to pay attention. We know that there are increasing utilization for ICUs, for hospitals. But if you look back to April, where our hospitals were completely overrun, right now we're still able to get people in. There are some major hospitals that have closed their ERs, but there are still other places where they can shunt them. So this is something that we have to keep an eye on. I myself, I have 50 patients in the hospital. I've discharged about 20 in the last week. So what that means is that we're making room as we go along, and as long as the number of cases is still, we can still accommodate them in the hospitals, then maybe we can loosen up if that looks good. But if the healthcare utilization keeps rising, then we might have to do other measures.